I've got Gary Leifer from Walsh Urology and Associates. He's here to talk about overactive bladders and treatments for it. And I believe I probably need treatment for that. Probably a lot of us do. How are you?
I'm great, thanks. Nice to see you again. How
You
are
as
you?
well. Welcome back. I'm good. I'm good.
Thanks
I'm
so
actually
much.
really curious, of course. So I guess the obvious, it seems self-explanatory, but what is overactive bladder?
Overactive bladder is symptoms of frequency and urgency and sometimes urinary incontinence. And it's probably, if not the most, one of the most common problems that patients deal with as they age. In fact, the incidence goes up almost 10% per decade.
Whoa.
So by the time patients are in their 60s or 70s, 60 to 70% of people are having some type of overactive bladder symptoms.
So it's inevitable for the vast majority.
It really is. It hits women at an earlier age, but men get it at a little bit later point in life. But almost inevitably, patients have some degree of symptoms.
Gotcha. Interesting. So let's talk about treatment. How is it treated?
Well, I think there's some very simple things we try initially. We try some behavior modification in terms of when patients drink, how much they drink, trying to go to the bathroom on a time schedule, et cetera. Sometimes we use physical therapy, which is a very non-invasive modality, which a lot of patients are benefited from. And then the second line of treatment is usually drug therapy. Drugs that relax the bladder muscle to give patients more time to get to the bathroom, less frequent visits, et cetera. The problem we have with drug therapy is most of the older drugs, which have been available for quite some time, have problems in terms of affecting cognition in older patients. So it can affect memory, it can cause confusion. And so since this is a condition that worsens with aging, we're very reluctant to give those patients those types of medications because of concern for that. And the newer medications, which don't have the cognitive side effects, unfortunately are extremely expensive and not covered by a lot of the insurance plans. So the patients are significantly burdened by trying to find a solution. So it's kind of forced us to be creative and look for other options to treat these patients.
Mm-hmm. Oh, they're kind of caught between a rock and a hard place.
They really can be.
Yeah, so let's talk about new methods of treatment for patients.
Okay, so I think the two exciting new methods that we've been using for the last couple of years are Botox and a procedure called Interstim. And Botox is exactly the same medication that is used for cosmetics. And the way it works cosmetically and the way it works in the bladder is it causes bladder muscle relaxation. So if the bladder muscle relaxes, the bladder will hold more, patients therefore go less often, and they have more time to make it. And the Botox procedure is very simple. It's done in the office just with local anesthesia, and the results can last for up to 6 months or more, and has very few, if any, side effects.
Who knew that Botox had more than one purpose? Go on.
Exactly. The other treatment, which we've been using relatively frequently lately, is called Interstim. And Interstim is a procedure where you put a little wire electrode, it goes into the lower back, and it goes into the area where the bladder control nerves are. And it sends a constant stimulus, kind of like a pacemaker does for the heart. It sends a stimulus to the nerves in the bladder, and it tends to inhibit those frequent urges to go. And again, a very simple outpatient procedure, and if it's successful, patients get dramatic results, and the pacemaker batteries last up to 5 years. So a patient can have a pretty simple outpatient procedure, be markedly improved, and not have to deal with medications or anything else invasive for 5 years or more.
Interesting. Wow. So that sensation when you have to pee, for some folks, could it just be this, like your sensors are off?
Exactly right. It's almost like somebody has reset their thermostat at a lower level. So they hit a smaller volume in their bladder and they get this premature urge like they need to go. And so the Interstim basically almost resets that at a higher level so that they don't get that urge prematurely.
Technology is just mind-blowing.
It really is.
Amazing. Really amazing. Let's talk about, is there any proactive approach to this?
Well, I think it really seems to be most out of our control. I think the only things patients can do lifestyle-wise is things like caffeine or irritants to the bladder, and they make the frequency and urgency worse. And I think patients oftentimes learn to time when they drink, et cetera, but really there are no medications, there are no herbal stuff, there are no dietary things that really have much of an impact on the development of overactive bladder.
Interesting. See, we're all learning something today. All right, I appreciate you being here. For more information, follow them on YouTube as well as Facebook, Walsh Urology. You can find Walsh Urology and Associates in Rancho Mirage. Give them a call or go online, walshurology.com. Big thanks to Dr. Leifer for being here, and a big thanks to you. We'll see you in just a couple of minutes.